Amyl nitrate is a chemical compound with the formula CH3CH24ONO2. This molecule consists of a 5-carbon amyl group attached to a nitrate functional group. It's the ester of amyl alcohol and nitric acid. Its common street names are rush, liquid gold, and poppers. At room temperature, it's a clear liquid and functions as a potent vasodilator. It's commonly used as an inhalant, and it also has some psychoactive effects. Apparently, it smells like old socks or smelly feet, and it's most commonly used in the gay community. Let's take a look into the history of amyl nitrate poppers. First, in 1857, amyl nitrite was first discovered and used to ease chest pains or angina. In 1867, doctors discovered that the vasodilatory effects of amyl nitrite were causing smooth muscles to relax. That's beneficial to patients with heart pain and angina pectoris. In 1937, it was marketed for prescription drug use. In 1960, upon FDA approval, poppers became an over-the-counter drug. In 1984, a cover story of Time magazine probed the abuse of alkyl nitrates associated with AIDS. Then in 1987, the New England Journal of Medicine issued a report about AIDS associated with the use of nitrites, but conclusions failed to support previous reports on an elevated virus antibody filter or Kaposi sarcoma. Then finally in 1988, it was banned in the US under the Anti-Drug Abuse Act. Let's go into the legal status of some of these drugs in different parts of the world. In Australia, it is illegal to sell poppers as inhalants, although some, including amyl nitrate, are often sold in sex shops, misleadingly labeled as DVD or leather cleaner. In Canada, the sale of poppers in any formulation has been banned. Although not considered a narcotic and not illegal to possess or use, they are considered a drug. Sales that are not authorized can now be punished with fines and prison. In the UK, poppers are sold in nightclubs, bars, sex shops, over the internet, and in markets. It's illegal to sell them for human consumption, and in order to bypass this, they're usually sold as odorizers. In the US, substances containing amyl nitrate are available at many retailers and may be purchased legally. In retail formulations, they are labeled as video head cleaners, nail polish removers, and room odorizers. Let's look at the effects of amyl nitrate poppers. Physiologically, they expand blood vessels, resulting in the lowering of blood pressure. They're also a source of nitric oxide, which signals for the relaxation of involuntary muscles. Physical effects include decrease in blood pressure, headache, flushing of the face, increased heart rate, dizziness, and relaxation of involuntary muscles, especially the blood vessel walls in the internal and external anal sphincter. There are no withdrawal symptoms that are known that are from amyl nitrate. Overdose symptoms include nausea, vomiting, hypotension, hypoventilation, shortness of breath, and fainting. The effects set in very quickly, typically within a few seconds, and disappear within a few minutes, leading the individual to keep taking more hits. In the body, amyl nitrate poppers are most directly affecting the parasympathetic nervous system, in which to decrease blood pressure. It is hypothesized that the pons, thalamus, amygdala, and hippocampus are the regions of the brain most affected by the use of poppers. Next, let's take a look at the pharmacological effects of amyl nitrate poppers. Nitric oxide causes vasodilation through a combination of cellular processes. The first is by activation of guanylate cyclase, which promotes the conversion of GTP to cyclic GMP. The increasing cyclic GMP binds to regulatory binding sites for protein kinase G, thereby activating the catalytic units that enable protein kinase G to reduce systolic calcium levels needed for smooth muscle contraction within blood vessels. In addition, nitric oxide is also known to cause direct activation of calcium-dependent potassium channels, resulting in a hyperpolarization and relaxation of vascular smooth muscle cells that allow for increased blood flow. Viagra, which is a phosphodiesterase type 5 inhibitor, also has vasodilatory effects, and when taken with amyl nitrite poppers, can have harmful interactive effects. Let's look at the abuse and addiction potential of amyl nitrate poppers. To date, use of alkyl nitrates as a psychoactive substance has received little attention in addiction textbooks, where they are subsumed among other inhalants. Substantial differences in both mechanism and typical risk between alkyl nitrates, which act on a specific nitric oxide pathway, and inhaled solvents and propellants that exert their effect through combinations of mild hypoxia, direct chemical interaction with neuronal membranes, and agonism at various receptors. The use of alkyl nitrates carries some medical risks. Most common are headaches from the vasodilation or mild chemical burns from the solvent medium. Most significant in a sexual context is phosphodiesterase 5 inhibitors, which can interact with nitric oxide releasing agents like nitrate poppers to cause substantial vasodilation, leading to serious cardiovascular complications and possibly death. In individuals with glucose 6 phosphate dehydrogenase deficiency, alkyl nitrates can trigger a hemolytic anemia. There are also rare reports of visual changes. The misuse of amyl nitrate can lead to an onset of a number of significant health problems, including immune system suppression, red blood cell damage, and overdoses. They also cause a temporary reduction in CD3 plus T lymphocyte cells. A red blood cell disorder called methemoglobinemia occurs when the presence of poppers triggers a structural change in hemoglobin, turning it into a protein called methemoglobin, which has no ability to properly release its oxygen content, leading to oxygen deprivation. The National Institute on Drug Abuse lists both amyl nitrite and butyl nitrite as potential causes of sudden sniffing death syndrome, a form of unpredictable rapid death that occurs when inhalant abuse makes the heart muscle unusually susceptible to epinephrine and norepinephrine. I hope you've learned something about the history of this drug, its pseudo-legality throughout the world, its physiological and pharmacological effects, and its abuse and addiction potential. Thanks for watching.